Thank you.
Stay with us. Still ahead, we're going to talk with Loyola University immunologist Dr. Christopher Thompson about what to expect as we get closer to a coronavirus vaccine. That's when we come back. Coronavirus cases here in Maryland and across the country continue to spike, with even more cases expected as we head further into the winter months. But a coronavirus vaccine could be made available within just the next few weeks. And joining us more to break it all down is immunologist from Loyola University, Dr. Chris Thompson. Good morning. Thanks so much for joining us.
Good morning. Thanks for having me.
So we continue to see the rise in cases, and they were talking about the Thanksgiving holiday. Really, we don't know what those numbers are going to be. So what do you see as we head into the winter?
Well, we're starting to see those numbers now. So most people see signs and symptoms start to emerge after 4 days of exposure. We're in that window where things are getting worse. And it's not surprising we're seeing hospitalization rates going up more and more. Now, by 11 days or so, 97.5% of people have shown signs and symptoms. So I expect these numbers are going to keep going up, unfortunately. And if we don't change our plans for Christmas, it's going to be bad.
It's pretty dire. I know that's what a lot of the experts have been talking about. And the hope that's on the horizon is this vaccine that could be made available. We know from the governor we're about to get 155,000 doses. He's saying that's really only going to cover about half of the healthcare workers. So what are you expecting with this rollout of the vaccine?
Yeah, so I think the governor articulated it very well, and we need to vaccinate the people in nursing homes, the most vulnerable population, and we need to vaccinate frontline workers as quickly as possible. But remember, this is a 2-dose vaccine, so if we get 155,000 doses, I don't know if that's going to cover only 75,000 people, or if that counts for 2 doses for each. But we're not going to get the general public vaccinated probably until March or April at best.
And what advice are you giving to people who might be hesitant to take the vaccine? Because that's really the thing here. Not everyone is going to take the vaccine, and other folks are going to need more encouragement.
Right. So, and I think that's the biggest hurdle that we're going to have. So this vaccine appears to be quite safe. We have not cut any corners. The big difference here is that typically when you submit something to the FDA, it might take, months for them to get back to you about it. And now they've dropped everything else, and they're answering questions and looking at data about coronavirus vaccines immediately. So we've been able to speed up the process quite a bit. We're seeing a rollout in the UK already, and so we'll get even more data about a larger population being vaccinated there. If we want to return to any sense of normalcy, we need to get the vaccine. And we can't rely on herd immunity. Herd immunity requires about 70% of the population to get vaccinated for the other 30% to be protected. Some people can't get the vaccine because of underlying issues, so they can't be part of that 70%. We all have to do our part. And also, nothing has changed from a public health standpoint. We need to keep wearing our masks. We need to keep social distancing. We need to keep hand washing and staying home if we're sick. Otherwise, things will continue to get worse.
Listen, when it comes to the vaccine, too, I heard you say earlier this week there's some practical considerations to take into consideration, such as some people will have very minimal reaction to the vaccine. Others might be sick for a couple of days, and employers need to sort of make a plan for that.
Exactly, and we've had about 75,000 people who've been vaccinated already. So we have some good data, and most of the reactions are fairly minor. But employers do need to be prepared that you might have an employee who's out for a couple of days because they have a more severe reaction.
And before I let you go, do we know yet how long this vaccine is good for?
No, we don't. That's one of the scary things, too. We don't know how long protection lasts. And the really scary thing to me is we have no data about efficacy in children. We're just starting to look at kids down to the age of 12, but that's a big proportion of the population that we cannot vaccinate yet and probably won't be able to vaccinate for 6 to 8 months, something like that. So there's still a lot of unknowns, but the data we do have is incredibly promising and predicts great success and predicts a lot of safety for people who do take the vaccine.
All right, Dr. Thompson, thanks so much for sharing your time with us this morning.
My pleasure. Thank you for having me.
You're very welcome, and take care and be safe. That's right. Stay with us. Still ahead in our last half hour of 11 News Saturday morning.
Relief could soon be on the way. I'm Aixa Diaz in Washington with the stimulus talks on Capitol Hill as millions of Americans struggle during the pandemic.
Live, local, late breaking. This is WBAL TV 11 News Saturday morning.
Good morning and welcome back to 11 News Saturday morning. Thanks for joining us. We're going to get to all of our top stories in just a moment. First, a check outside, and Taylor, the sun is shining.
That's right. The rain has cleared out and it's going to be kind of chilly throughout today. So yes, we finally had the sun back in the forecast, and here's a live look at radar. The last batch of rain is starting to exit the Delaware coastline, and the rest of this weekend is going to be nice and dry. So the sun will come out in spots today. It is going to be windy and chilly though, with high temperatures in the 40s. I'll have a full look at that 7-day forecast coming up.
All right, thanks, Taylor. Relief could soon be on the way for millions of Americans as Congress gets closer to a new stimulus package. And this all comes as the pandemic continues to rage across the country, setting new records in daily deaths and hospitalizations. 11 News reporter Aixa Diaz is live in our Washington bureau. And Aixa, how quickly could this bill pass?
Jen, it could be soon. It could be in the next couple of weeks. Lawmakers say they want to get this stimulus package done before they leave for their holiday recess in 2 weeks. This is far from a done deal yet, though. A lot of negotiations still to take place, but it's the most promising sign yet that a deal is on the way.
Negotiations are underway to pass a $908 billion stimulus package before the end of the year.
There is momentum.
Speaker of the House Nancy Pelosi in talks with Senate Majority Leader Mitch McConnell, looking to provide relief to unemployed Americans, business owners, schools, and healthcare providers. President-elect Joe Biden urging Congress to act now as he announces that he will ask Americans during his inaugural address to wear a mask for 100 days.
But if people do it for 100 days, in the middle of what will be still a raging crisis, and the vaccine is able to be distributed, they're going to see deaths drop off the edge.
The COVID-19 pandemic showing no signs of slowing down in the U.S., with deaths topping 279,000. Vice President Pence visiting the CDC yesterday, expressing optimism about upcoming vaccines.
Maybe, Bob, just a week and a half away from what will be the likely approval of the first coronavirus vaccine.
And if the FDA grants emergency approval in the coming days, states could begin vaccinating frontline workers before the end of this month, Jen.
All right, Aixa Diaz reporting live in our Washington bureau. Well, Maryland's election results in the 2020 presidential election are now officially certified. President-elect Joe Biden received 65.8% of the vote. President Trump received 32.2%. This election cycle, half of Marylanders who voted chose to do so by mail. Officials say typically only 4 to 5% of Marylanders usually cast their ballots by mail. And a federal judge is now ordering the Trump administration to uphold an Obama-era program that shields some undocumented immigrants from deportation. So that means new DACA applicants must be accepted. DACA is short for the Deferred Action for Childhood Arrivals, and it protects undocumented immigrants who came to the U.S. as children. Last month, a judge ruled that acting Homeland Security Secretary Chad Wolf was not legally serving in his position when he signed rules limiting DACA applications and renewals. Yesterday, the judge ordered Wolf's rules be vacated. And yesterday, the U.S. House of Representatives passed a bill that would end the federal ban on marijuana. This is the first time that a chamber of Congress has approved a measure about the drug. The bill would remove marijuana from the federal list of controlled substances, and that would effectively decriminalize it across the country. That bill would also create a process to remove prior pot convictions. If passed by both chambers of Congress and signed into law, individual states would still need to legalize marijuana. Well, stay with us. Still ahead in today's Woman's Doctor, we're going to talk heated chemotherapy with our experts from Mercy. Plus, Taylor has another look at our weekend forecast. You're watching 11 News Saturday morning. In this morning's Woman's Doctor, a treatment that can help ovarian cancer patients live longer. It's called heated chemotherapy, and it's administered during surgery. 11 News reporter Lisa Robinson has more.
After a surgeon removes cancerous tumors, tubes and temporary probes are placed in the abdominal cavity. The doctor briefly closes the skin with sutures. The area is then flooded with a chemo solution that is heated. Together, the heat and solution kill microscopic cancer cells. The procedure is called heated intraperitoneal chemotherapy, or HIPEC for short. Mercy Medical Center Dr. Teresa Diaz-Montes says it has been used to treat appendiceal cancer for a long time.
Now for ovarian seems to be increasing the overall survival of patients who are treated with this modality.
Dr. Diaz-Montes says anyone considering HIPEC should make sure they choose a doctor and a team with a lot of experience. Lisa Robinson, WBAL TV 11 News.
And Dr. Diaz-Montes is joining us now with some more information. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
You're very welcome. So go ahead and tell us who would be a candidate for HIPEC.
So a patient who has a recurrence of ovarian cancer, depending on certain characteristics that we look at, could definitely be a candidate. In initial treatment, patients who have received chemotherapy up front, we can treat them with heated chemotherapy or HIPEC. As a research protocol, that's a protocol that we have at Mercy. Any patient with a suspicious of ovarian cancer, they need to be enrolled in a clinical trial that we had opened in order to be administered that treatment. Like, we cannot offer it at us because it's not considered yet standard of care. But under the research protocol, they could receive it.
But why is this something that can only be administered during surgery?
Because the main, for HIPEC to really be effective, you have to remove all visible tumor. So if you don't have a good operation from the beginning, then HIPEC is not going to be effective. So my key message for the community out there is that you need to be taken care of if you're considering HIPEC. They need to be performed by a group of surgeons who are very familiar with the complexity of the surgery and can remove all visible tumor. So then when HIPEC is administered, is more effectively.
So it sounds like this is something that's getting a lot of good response. It has to be sort of exciting in the field that you're in to see something new like this working.
It is. We have focused a lot in chemotherapy. So it's very exciting to see that if you do on the upfront in terms of surgery, and that you can improve the survival of patients by doing a treatment like this. And you adding more to the alternatives that we have for ovarian cancer. So right. Yes, like seeing that all these studies are coming and showing that there's a promise and progress is very, very exciting.
All right, Dr. Diaz-Montes, thank you so much for joining us this morning. Really appreciate it.
Thank you. Thank you for having me, and just be safe. And if anybody's interested in looking at this, they can call to Mercy and we will be more than happy to offer them a consultation. Have a good weekend. I am glad you said that because we're about to put the number up there on your screen. Thanks so much and you have a great weekend. If you have any other questions or you'd like a referral, call this number 1-800-MD-MERCY. And stay with us. Still ahead on 11 News Saturday morning, we're going to take a look at some of the new movies streaming this weekend and get our reviews from our film critic Lauren Veneziani. Plus Taylor's tracking our weekend forecast. You're going to get blown away out there today.
That's right. The wind's going to continue to pick up. The sun is out. It's going to be a chilly weekend ahead, so I have a full breakdown of what to expect coming up.
Now, your WBAL TV 11 weather forecast with meteorologist Taylor Grenda.
Welcome back. The time now is 9:13, and all the rain that we picked up on last night has since moved out of the area and it's just starting to exit areas of Delaware right now, and will continue to move off the shoreline. It's actually all associated with a storm system that came together right over the mid-Atlantic. Now it's continuing to lift north and east, and as it does, it's going to pack a punch on areas across New England. It could pick up on accumulating snowfall there, and as it also pulls away from our area, the wind's going to actually pick up behind this. So even though we'll continue to dry out, the sun should come out as well. It is going to be windy and also pretty chilly too. So mostly sunny by this afternoon as temperatures near the mid to upper 40s. So even in terms of temperatures, it's really not going to warm up much for today. Add the wind on top of that, and it's certainly going to feel much colder. So if you do have outdoor plans, I would plan for it to feel like the lower 40s all day long. Later tonight, we'll continue to clear out, and that's going to lead into a much colder start tomorrow morning. I think some areas could drop below freezing by daybreak on Sunday. For today, if you're trying to plan it, again, temperature-wise, we should be in the upper 40s. However, with the wind, it's going to feel a bit colder out there, so we will have that wind chill as a factor. Once the sun sets, temperatures should drop off pretty quickly with clear skies, and it's going to be a cold start as we get closer to tomorrow morning. So overnight low temperatures should drop at or below freezing for areas north of the city. We're talking Westminster and Frederick could drop to near 31 degrees, 28 for York, 34 Aberdeen, 33 downtown, and 35 in Annapolis. Tomorrow should feature plenty of sun, so it should be a nice day, pretty day that is, for outdoor plans. It's going to be nice and dry. However, it's still going to be pretty chilly too. So we'll at least lose the wind tomorrow. Temperatures, though, should only top out in the low to mid 40s. Here's a check on that 7-day forecast. It's going to be a nice dry week ahead, nice and chilly too. So by Monday and Tuesday, morning temperatures could drop into the 20s with afternoon highs only in the 40s. We're in the mid 40s on Wednesday, finally back to the 50s by Thursday and Friday.
Thanks, Taylor. Time now for a look at what's streaming this weekend, and our film critic Lauren Veneziani joining us live this morning. Hi, Lauren. Good morning.
Good morning, Jen. Good to see you, even if it's just through Zoom again.
I know. I'll take you any way I can get you. Always.
Yes. Well, I'm glad that you're back because there's obviously so much that is streaming. And now that we're getting into holiday time, there's always some good holiday, series or movie I'm recommending. And Jen, I'm interested if you or maybe you and your daughter have watched Dash and Lily. This is a new young adult book series. It's based off of a young adult book series. It's on Netflix. It's an 8-episodic series. It's a holiday romance about a more reserved Dash, played by Austin Abrams. But when he meets this charismatic and optimistic Lily, they don't, know who each other is yet, but they exchange notes throughout the city of New York. So it kind of has a little bit of a You've Got Mail vibe going on, and it's totally just a beautiful, Christmas production throughout New York City. If you are having trouble getting into the holiday spirit, watch this show because it is just a joy to watch how they decorate New York City, and I had so much fun with it. So I'm giving Dash and Lily a 4 out of 5. All 8 episodes are currently on Netflix, and it's just a feel-good, young holiday romance to watch right now, Jen.
Okay, that looks adorable. What is Meg?
It is. Okay, so Jen, this is something totally different, also available on Netflix. Now, this is from director David Fincher, one of my favorite directors, who, of course, has done Gone Girl, Fight Club, The Social Network. This is actually a black and white feature film on Netflix. It may be Netflix's first original black and white feature film, and it follows screenwriter Herman J. Mankiewicz's journey as he writes his screenplay for Orson Welles' Citizen Kane. So essentially, it's about the journey of the screenwriter who wrote Citizen Kane. Mank is played by Gary Oldman, who's absolutely fantastic in the role. The movie also stars Amanda Seyfried and Lily Collins, of course, our own Emily in Paris, who I love so much. And the costumes and the sound design are fantastic. The director actually uses this monotone sound, so it really feels like you're watching a picture from the 30s and 40s. But Jen, I'm a cinephile. I love movies about movie making. I'm really interested to see how this movie is going to connect with maybe non-cinephiles like myself. But the most interesting part of the movie is just to see how Hollywood was in the 1930s and 1940s. I really